Well, for the first time in more than 20 years, the life expectancy for Americans is declining. And scientists believe a wide range of health problems are to blame, and one of them is this issue with heart disease. Dr. Campbell is a practicing cardiologist, assistant professor of medicine at the University of North Carolina. And so, Doc, here's the headline from the Wall Street Journal. Nation's death rate rises as progress against heart disease stalls. I'm just looking for your personal experience as a heart doctor. Have you noticed a stall in really progress when it comes to heart disease?
No, I think we continue to make progress every day when it comes to, defeating heart disease, new treatments, new therapies. I think the problem is the fact that we're a nation of obese people, and when you're obese, it puts you at risk for diabetes, high blood pressure, and ultimately heart disease.
So since 1969, if you look at the statistics, death rates from heart disease declined 70%. It was a huge decline since we've sort of pinpointed some of these issues. But a couple of years ago, that decline started to reverse itself. And so you're saying that reversal, just slight reversal, is because of obesity?
I really think so. Last year alone, we spent $150 billion, that's with a B, dollars on health care related to obesity and obesity-related illness. I think that if we continue on this same trend, you're going to see not only 1 in 3 Americans be obese, but almost 50% in the next decade. So we really have to work on this as a nation.
Why do you think that is? Because you would think, 20 years ago, what we thought about nutrition, carbs versus protein, was, it was different. And it would seem that we have more information. So why aren't we better off?
I think the problem with healthcare in the U.S. right now is we focus so much on treatment and so little on prevention, and that's where the Affordable Care Act has really failed. I think if we focus on prevention of disease, we can better educate our patients and make sure that we eat better. 1 in 3 kids is obese right now, so we've got to set better examples for our children.
That's really, that's a really high statistic. Very interesting fact. There's something else in this Wall Street Journal piece I wanted to ask you about that's related to heart disease, but I'm just curious your opinion as a medical professional, Doc, and this is what was written in the Journal, that 2 Princeton University economists identified rising death rates in white, middle-aged Americans, driven largely by increases in deaths from suicide, drug overdoses, alcohol abuse, and chronic liver diseases. And when I read that, all I see there is sadness. Like, those are disease. That's when you're sad. There's something more going on than just you're eating badly. What's your read on that? Why that's happening?
I think that, there's been a lot of hopelessness in this country, and the opioid addiction problem has been huge. That's been a huge cause of death, accidental overdoses and suicide, especially among teenagers and children. I think that, we have to give our kids hope again, and, I'm hoping with the new administration we can actually do that, make people feel good about what's going on, support our children, support our seniors, make sure that everybody feels like they've got a fighting chance.
It's interesting. I thought there were some crossover themes in that. It was interesting to get your perspective on it, because our old age mortality rate hasn't changed that much, but those dying in middle age, that's what we're seeing, and one wonders, what are some of the underlying issues when we talk about prevention? Dr. Campbell, it's great to have you on the program as always. Thank you so much.